Hi everyone, this is Vince again with Insurance School, and today we're going to talk about your health insurance and how do you know what providers you can actually see, whether they're in network or out of network. Sometimes people may choose a plan which is a in-network plan only, an EPO plan or an HMO plan. And the only way that you are going to know whether your doctor is in network with your benefits plan is, first of all, you can actually call the doctor's office, and you want to make sure that you're careful in the way that you ask the question, because it matters how you ask the question, and it also matters how you are being heard by the person you're asking the question to. Oftentimes people make an appointment in a doctor's office and they'll say, do you take my insurance? And the person at the front desk, unfortunately, may or may not be trained in specifics as far as network status. They don't know all the providers that are in network with all the different insurance companies. So you may receive an answer from somebody at the front desk that says, oh yeah, we take that insurance plan. Next thing you know, you make an appointment, go to the doctor's office, and they want a considerable amount of money up front for whatever reason. It could be a copayment, it could be a deductible, or it could be because that provider's out of network with your specific insurance plan. So it's really important on how you ask the question. Are you contracted with my insurance plan specifically? And make sure that they understand the question, the person that you're asking that question to at the doctor's office. If they're not sure, you can actually ask to speak to an office manager. Oftentimes the office manager is well aware of whether a doctor is contracted with an insurance plan or not. The other option you might want to consider is asking the doctor's office on the phone what their NPI number is. The N is in Nancy, P is in Paul, I is in Indigo number. Really important to gather that number, because that's the identifier that providers use with insurance companies. And it tells the insurance company, this is the doctor, this is who you're seeing, this is how they're registered as far as with the insurance company or not. And you can actually go back to, if you have a member services company with your insurance company, where you can pick up the phone and call somebody and say, hey, is Dr. Joe Smith in network and contracted with my insurance? Or you can provide them with that NPI number, and then they can check to make sure that that doctor's office is contracted with your specific insurance plan. Biggest reason why you want to do this is you don't want surprises. You don't want to all of a sudden think that you're going to an in-network provider, find out they're out of network. If you have no out-of-network coverage at all, you're going to end up having to pay the entire bill yourself. Or if you have a PPO plan, which allows you to go in and out of network, albeit you can see an out-of-network provider, but the caveat is this: oftentimes the coverage is less. You may have a high deductible going to an out-of-network provider, which is separate than your in-network deductible. You may have a high co-insurance obligation. Oftentimes when you go to in-network providers for a sick doctor visit, you might have to pay that deductible. But your co-insurance may be 80-20, where 80% is paid by insurance, 20 by yourself, or 90-10, for instance, where 90% is paid by your insurance coverage and you pay 10% after deductible. Conversely, if you go to an out-of-network provider, that deductible might be $500. It may be $1,000. And then at that point in time, after you satisfied that out-of-network deductible, then all of a sudden you go to co-insurance. And that co-insurance could be a 60-40 split, where 60% is paid by insurance and only 40% is paid by you, but you're going to pay more out of pocket. And then there's one more little bit of information that I'd like to share with you in regards to going out of network providers. But do me a favor, if you would, if you're finding the information that I'm providing to you, tricks and tips and ideas on how to get better acquainted with your insurance and use your insurance better, please hit the like button, subscribe to my channel, hit the bell so that you get the notifications when my new videos and content come up. I'm just trying to get the word out to everybody, trying to help them. I mean, insurance is a crazy business, it's crazy to deal with, and most oftentimes we don't want to deal with it, and it's a difficult proposition. So please subscribe, let your friends and family know that I'm here and trying to help and get the word out, and do appreciate that. But going back to the out-of-network provider, there's another piece that I wanted to discuss with you, and that's called balance billing. And balance billing is a little tricky situation, especially if you're going to an out-of-network doctor. Those doctors do not want to accept what's called the contracted rate that an insurance company is willing to pay other doctors that perform the same services or provide the same services to the same kind of patients. So those doctors are charging more than the insurance companies are willing to pay. That's why they don't contract with insurance. That being said, if you go to an out-of-network doctor, for instance, let's just say for conversation's sake, your in-network doctor would be a $50 copay to see your primary care physician for a sick doctor visit. But if you go to an out-of-network primary care physician, you have that deductible once again, okay? And let's say that out-of-network doctor charges $150 rather than $50. So that $50 going to the out-of-network doctor is going to be recognized by your insurance company. That will apply towards a deductible. That will apply towards coinsurance. The excess that doctor that's out-of-network is charging, that $100, that doesn't count towards your deductible. That does not count towards your coinsurance, and it does not count towards your out-of-network, out-of-pocket max. That comes out of your pocket. That excess charge is balance billing. Doctors have the right to do that. They can notify you that they're not in network with the benefits plan, and these are what my charges are going to be. So you're going to end up having to pay more for that doctor's visit once again, albeit if you have the option, you can do that. It's not that you can't do it, but it's really important to understand what your financial obligation is going to be going to an out-of-network doctor compared to an in-network doctor. So let's kind of go back a little bit to the beginning of the conversation here. And if you're going to a doctor and you're not sure if your doctor's in network or not in network, the last thing you want to do is find out on the back end when the claim processes and say, well, how am I supposed to know? We have to take responsibility for our own decisions. So one of the ways that you can find out if your doctor is contracted with your specific insurance plan is, first of all, ask, are you contracted with my blank blank insurance company? Okay. And then you can ask them for their NPI number. You can reach out to your insurance company. You can check to see if that NPI number matches your in-network doctor list. If you do, and you're good to go, then go ahead and make your appointment. If the NPI number does not come up or doesn't match, then you're going to probably end up going to an out-of-network doctor, and you shouldn't have any surprises about that as well. Being informed up front on whether a doctor's in network or not is really, really important for you to understand what you're going to be paying out of pocket, what your financial obligations are going to be. You just don't want to have any surprises on the back end. I hope this information has helped you gather some good documentation from the doctor's office. Get that NPI number. Check your health insurance website. Make sure you're checking your health insurance's website, not a random health insurance website. I mean, sometimes people say, okay, I have Blue Cross and Blue Shield of Illinois, and they just Google Blue Cross and end up just searching Blue Cross, or they have a local Blue Cross plan, for instance. And I'm not just talking about Blue Cross, but really important to make sure you're going to the correct website. So you want to reach out and find out what the correct website is for your health insurance. You might be able to check that way. Make it a little bit easier on yourself. Gather the doctor's first name, last name. If you're talking to somebody at that doctor's office, get the name of the person that's telling you, yeah, we're contracted with the insurance plan. So if there's any surprises on the back end, you have somebody to go back to with the office manager and say, hey, this person told me that your office, your doctor was contracted with my insurance. The doctor's not. The NPI number, I was never given an NPI number, but you need to make sure that you do your due diligence to make sure things are covered properly for you. Once again, if you appreciate the information and you find this information valuable, please do hit that like button. Let your friends and family know. Subscribe to the channel. The more people that subscribe to the channel, the better opportunity I have to get this information out to everybody, and hopefully make your life a little easier, family members' life a little easier, friends' life a little bit easier, and other people that are dealing with insurance questions and concerns. Give me a subscription, follow along, and hit that notification button as well. Thanks for your time, and please, any other questions or concerns, feel free to drop them down below. I'll be more than happy to address any other questions you may have about home, auto insurance, health insurance, life insurance. Reach out. I'm here and happy to help. Have yourself a great day.